Welcome to the second part of Module 20, Human Resource Management in Public Health. I'm Professor Donna Gourlay. The Public Health Foundation developed this list of 8 domain or skill areas for the public health workforce. Take a moment to review this list. Does this look like any of the courses that you are either taking or will take as part of your MPH degree? Does this look like PCOR? Imagine working with a group of public health professionals who do not have all of these skills. What would that be like? How effective could you be in your job? And how effective could you be in improving the health of a population? If you have all of these domains, what type of position would you be qualified for? The goal of managing a public health agency is to create an engaged workforce that can meet the needs of both the organization and the community. An engaged workforce is the key to ongoing success for any organization. What does engaged mean? Well, Gallup has done a lot of work in this area, including a 12-point questionnaire to assess the engagement of an organization's employees. Loma Linda University Health participates in Gallup's Q12 assessment each year. But what does engagement mean? Engagement is defined by Gallup as employees willing to go the extra mile, work with passion, and feel a profound connection to their company. They are the people who will drive innovation and move your business forward. According to Gallup, the majority of employees across the globe are not engaged with either their work or their employer. Why? Often it's because an employee is mismatched with the organization or to a career. As leaders, it is our job to determine what our employees are good at, what they enjoy doing, and find a match within the organization. The Public Health Foundation organized the workforce into 3 tiers and identified the types of tasks and responsibilities each would perform. The first tier are entry-level staff who are collecting data, interfacing with customers, like the public, and are supporting programs through communication, outreach, and service. This first tier would be boots on the ground. The second tier is more supervisory in nature and manages schedules, plans, and timelines, in addition to providing technical expertise to the first and third tiers. The third tier is the executive leadership, who are responsible for oversight of operations, holding people accountable for high work product, and they are the face of the organization to the community. Often this person or people need to be good at navigating politics between the organization and legislators, the community and other stakeholders, and being an advocate for their employees. Within the administration or C-suite of a public health agency, important management functions occur, including management of information, communicating both within and outside the organization, programs such as performance assessments, data on participation and outcomes, financial resources, including human resources, which is where 80% of an organization's costs occur, and other human resources functions like legal, recruiting, counseling, mediating between parties, and compensation. A public health agency, particularly a governmental one, must develop a workforce plan for approval by an oversight body. This plan identifies specifics that pertain to the number and size of employees, salaries and benefits, and remember this is the majority of the expenses of the organization, and analyzing job details, which includes the types of tasks performed, what key knowledge or skills are required, the context of the job, its responsibilities, which are different from tasks, the conditions in which the work will be performed, and who will provide day-to-day supervision of Tier 1 staff. This simple graphic illustrates how the job analysis on the left drives the content of the job description, which is used for recruiting a qualified pool of candidates from which to select the best people. So how do you build a good team that is engaged and committed to your organization? Well, people need to feel satisfaction with what they do. This occurs by educating them about their job duties, connecting what they do to the mission of the organization, giving them feedback on their performance, and giving them opportunities to grow. Money has consistently been shown by employees of all types of organizations that it is not a motivator for either employee performance or engagement. With the changes in the workforce, the workplace is also changing. For example, an epidemiologist could work for a governmental agency, healthcare, a nonprofit, academia, or a for-profit organization like a pharmaceutical company. In other words, competition is high for all public health professionals. So, you've assembled a great team of public health professionals. When things go smoothly, it's like driving down the freeway at the speed limit, and maybe faster. You get to where you need to go. But when something happens and a problem surfaces at work, it's like you're still driving down the freeway, but you've got a flat tire. That slows down your speed and derails you from reaching your destination. How do you know that a problem exists? Well, an employee might report this to you. You identify problems between an employee, other coworkers, and perhaps customers. Or there is a decreased performance from this employee, which can spread to other employees if not addressed. Once you've identified where the problem is coming from, you need to identify what the problem is. Doing this involves conversations with the employee to determine the problem and the root cause. By identifying the problem, you can help the employee by coaching them through it, referring them to outside help such as employee assistance or counseling. The next is to set goals and deadlines for the goals. This is also called a performance improvement plan. It's best to document every interaction that you have with the employee in the event that discipline or termination needs to happen. When the deadline is reached, reassess the situation and talk with the employee. This may involve a performance review to determine what to do next. If the employee has improved, you've saved the employee. And most employees will improve with coaching. However, if the employee has not improved, it is important to take action, which is based on the severity and reoccurrence of the problem. Taking action will demonstrate to the other employees that you are in charge and are addressing the problem. Ignoring the problem doesn't make it go away. Actually, it's the reverse. It spreads like wildfire, and other employees now have a bigger problem. I want to share a few examples of things I've had to address during my tenure in management and leadership. One employee failed to report to work for multiple days without notifying me that they were sick. When this occurred a second time, we sat down and developed a 30-day performance improvement plan. This was because the employee had essentially abandoned their job. At the end of 30 days, I was not satisfied with their performance and was going to extend the deadline of the improvement plan. However, the employee resigned, which actually saved us all the hassle of termination. In the next example, I shaped a dynamic, passionate team. They were all go-getters. However, the problem was that they were a lot alike, and that created conflict among them. How I handled this was to listen to both employees separately that had the conflict. Then I brought them together and mediated between them. I actually had a 100% success rate for this method to resolve the conflict, and every time it involved miscommunication and misunderstanding. Once they had the opportunity to talk in a safe environment, the conflict was always resolved. The last example was a new employee who did a great job. He was dedicated and excited to come to work. However, there was a problem with his performance. It gradually started to decline, and when we sat down to talk about it, I had a suspicion that he was using drugs. I contacted Human Resources Management and Occupational Health, and we agreed to bring him in and have him drug tested. I drove him to the appointment, and the results confirmed my suspicions. He tested positive. Based on workplace policy, which has a zero tolerance for drug use, I had to terminate him. As you can see, some of these interactions were successful, others were not. Not everyone desires to be a leader, but some of you watching this might have aspirations for public health management. Once you get into this tier of an organization, realize that you often will no longer be the expert in your field. You will become an expert in management, which has its challenges and its successes. Thanks for watching.